Hello everyone, welcome to the channel. In today's short video, we will learn about the concept of lead time bias in screening. So before understanding the lead time bias, we have to understand what is screening time and what is lead time. So as this slide depicts the model of screening of detection of various diseases, there are 4 points which can be seen on the slide. So first is the disease onset. This is a biological onset of disease. First possible point indicate the point from which the disease can be detected. Then we have a final critical diagnosis. This is a point after which there is no point of screening. This is the last point in the preclinical phase where a screening test can detect a disease before it becomes symptomatic. So what happens beyond this point, the screening loses its value because the disease will be detected clinically anyway. Now this is the usual time of diagnosis, means as the disease progresses, there are appearance of sign and symptom. So this is the time that usually the disease is diagnosed due to the appearance of symptom. So screening time is the time between the first possible point from which the detection of disease is possible to the final critical diagnosis. Then comes the lead time. So lead time is defined as the interval between the point at which the condition is detected through screening and the time it would normally have been detected due to the appearance and reporting of sign and symptom by the patient. So this time is the first possible point and this is the usual time of diagnosis. So this is your lead time. Now comes the lead time bias. So sometimes what happens, the early detection has no effect on the course of the disease. So although we have detected the disease early, we are not able to provide an effective treatment to the patient. So what will happen? It will be giving the patient a few more years of sickness and apprehension rather than health. So detected the disease earlier. So we have advanced the time of diagnosis without delaying the time of death. So we have increased diagnosis to death time. We will understand this in the coming slide. What happens then? It tend to show, due to this, increased survival among the screened group as compared to the group which is not given the screening test. So what will appear? It will appear like, since we have detected the disease early, there is increased survival time, but we have not altered the course of the disease. So what will happen? We have given few more years of suffering to the patient rather than health. So we will understand the concept of lead time bias with the help of this example. Here we have two patients. One is patient A, another is patient B. Both of them are being diagnosed for the cancer, but the patient A is diagnosed via screening at the age of 55. But the patient B is diagnosed after the appearance of symptom at the age of 60. And both of them died at the age of 65. So what it looks like that we have given, this patient died 5 years after diagnosis and this patient died 10 years after diagnosis. So patient B seems to have survived 5 years after the diagnosis, but in reality the both lived the same total lifespan because the earlier diagnosis of disease does not help in the treatment of disease. So lead time bias is the apparent increase in the survival time among the screened individual due to earlier diagnosis without actual improvement in the outcome.